Hey everyone, Milkman Al here. Today, we're going to talk about medical spas. So, I actually happen to own a medical spa, but don't worry, I'm not advertising to you. The pandemic pretty much nuked me from orbit and then stomped on my balls just for good measure on that front. So, I'm just here to tell you about all of the weirdness and the secrets of how this industry works and, like, what makes it go. So, as you may have seen, there are hundreds, if not thousands, of videos about administering Botox, fillers, things like that online, YouTube, TikTok, you name it. It's an incredibly popular, easy industry to get into, and tons of people are doing it. It's becoming much more mainstream, and lots of people have a lot of interest in it. So, let's talk about some of the stuff that goes on in this industry. So we'll talk about services that these spas offer in 4 different sections. So first is Botox, then we're going to talk about fillers, then IV therapy, and fourth is kind of everything else. So before we get into it, don't forget to like and subscribe. That'll help me out with the YouTube algorithm. I really appreciate it. All right, so here we go. So first off, we've got Botox, probably the most popular service individually. So Botox is basically about as easy as it could possibly be to administer, and strangely, there's been a whole cottage industry of training programs for Botox injection popping up around the country. Now, if you've ever looked into this at all, you'll know that these programs are extremely expensive, and usually they're only like a weekend long for maybe a couple hours, but they'll cost you up to like $3,000 to $5,000 each. So here's the secret here. There is no official training available for Botox. All of these places are just diploma mills. So, what I'm going to show you right now is the prescriber information for Botox. As you can see here, it has the spots where you inject very clearly marked with X's. As you scroll down, same thing here. These are for crow's feet. This is for glabellar lines, otherwise known as 11s. And then down here, you have injections to reduce forehead lines. So everything that you need is spelled out as clearly as can possibly be in the label for a Botox vial. You do not need somebody to hold your hand through this. This is super duper easy. And the manufacturer for Botox, Allergan, and also Galderma, which manufactures Dysport, the competitor for Botox, they offer live training sessions all the time. You just have to go and sit through some sort of sales pitch for whatever program or product that they're pushing currently, and then they have a bunch of live models available for you to practice on. That's it. No need to spend thousands of dollars or a weekend getting training for this. Get a vial of Botox, practice on some friends, give it to them at cost. No big deal. You'll pick this up in a flash. There's nothing to it. Like any skill-based thing, there is a little bit of art to the process, but the technical aspect of it, like I said, really couldn't be any easier. Botox works super well. People will ask you to do all sorts of weird, crazy shit, but if you stick to your guns, you just say, hey, this is what is in the prescribing information, this is how you do it, this is what I'm gonna do, you're never gonna get in trouble. Botox has recently gained a lot of popularity for functions with migraines. It's pretty effective for treating migraines, it seems like. I personally have never done those injections because it calls for 150 units, and most people cannot afford that. So, typical price for a unit of Botox, my cost, is about $6 a unit, and retail price is anywhere from 10 to 15, just depending on where you go, who injects it, what part of the country you're in, etc. So next up we have filler. And that's one thing that gained a lot of popularity with celebrities with their huge duck lips, especially the Kardashians and whatnot, walking around looking like blow-up dolls. Filler is super popular as well, but is even more expensive than Botox. For example, a syringe of filler, 1 milliliter of filler costs about $300 to $350 wholesale. Generally, a syringe of filler is advertised to last about 6 months or so, but in my experience, it lasts nowhere near that. Most of the volume increase at the injection site, whether it's lips, cheeks, like nasolabial folds, which is right next to your nose here, wherever your injection site is, most of the volume increase is due to acute swelling. And that generally goes away by 2 to 3 weeks, something like that. Personally, I have also noticed that a lot of people Not necessarily the ones I've injected, just people in general who get filler bruise pretty badly, especially under their eyes. And that's a big reason why I stopped offering it to anyone for any injection site other than lips. I feel like lips gave the best results, but again, they were still pretty disappointing by the advertised standards. So I feel like people got pretty decent results that they were happy with for maybe 3 weeks to a month, and then after that, it kind of trailed off. So I decided to slash my services because I wasn't happy with those results either. And one thing that a lot of places won't really tell you is that most likely you need multiple syringes of filler to achieve the results that you want, which again gets extremely expensive fast. And now there are different consistencies of filler. It's basically sort of like low-grade biological cement, if you want to think of it that way. So there's some that's kind of runny and some that's like almost rubbery, like kind of rubber cement and sticks where you put it. And which one you want to use kind of depends on, which area you're after and how much volume you're looking to get in that particular area. But in any event, I find that people generally are not super happy with just one syringe. You usually need more than that, and unless you're planning on spending thousands of dollars on this treatment, you're probably better off elsewhere. So one thing that people really try very hard to do with both Botox and filler is avoid plastic surgery. They're trying to get the results that they want without actually, having a general anesthetic and having some sort of cosmetic surgery on their face. A lot of the time, that's not possible. Some people want you to, try to remove deep set wrinkle lines or, remove their eyelid droop or what have you. But those sorts of things require a surgical procedure. And, while you can sort of put a band-aid on it with filler and Botox, ultimately you're probably going to spend a whole lot more money and traumatize your face a lot more by doing these procedures over and over and over. So it's better to just kind of bite the bullet and actually have plastic surgery, which is a good reason to actually go to a proper plastic surgeon's office when you're trying to, get some sort of facial cosmetic result. Because if they're a reputable place, they will inform you about these things. They'll say, hey, this is an option. You can go with the Botox, you can go with the filler, but really what you're going to need is surgery. And a lot of people don't like hearing that, and that's fine. It was sort of nice for me because as an anesthesiologist, that's not a service that I can even offer them. So I'm like, nope, you're not going to get results that you're happy with. So sorry, see you later. But, if you do go to a surgeon and you're open to that possibility, then that's something that I would recommend. So the third thing I wanted to talk about was IV therapy. Now this is gaining a lot of popularity. But one thing that you really have to watch out for is most med spas are managed by somebody who is not familiar with IV placement or infusions. Something that most people don't know is that the vast majority of these places are either run by family practice docs or physicians who actually never completed residency. They just did their first year of residency, so they are eligible for medical licensure, and then stopped. And basically, most of these people don't know how to run an IV infusion, and I do that all day, every day. In fact, in the Kansas City area, out of the dozen or so IV businesses that are present, only one business other than mine is owned and operated by anybody other than a family practice doc. And consequently, what you get from these IV infusions is generally little more than electrolyte water. A lot of the time you'll be offered things that sound really fancy. They've got lots of vitamins and amino acids and all sorts of stuff like that in them. But let me tell you, there's no way that those have any sort of biologically active quantity of those things in there, because if you were to go and buy, say, some amino acid or something from like a pharmaceutical company or a pharmaceutical supplier, they're hundreds to thousands of dollars, and there's just no way that they do that, because each of these treatments generally costs anywhere between $100 and $300, and they would just be losing money hand over fist. So basically, you're kind of paying for snake oil in a lot of conditions. That said, there are definitely ways to make an IV infusion awesome. So my company and the other one that was run by an emergency medicine doc were the only ones that offered medications in our IV infusions. And man, if you've got a wicked hangover, there is nothing better than some anti-nausea meds, some Toradol, which is like turbo ibuprofen, and a whole bunch of fluid. That's gonna fix you up really quick. You'll pretty much be back to normal in about 20 minutes. But as far as, getting energy or waking up or doing some sort of body cleanse or something like most of these places advertise, that's probably just not going to happen. There are some vitamins that, in large but still safe doses, are very effective, like vitamin D, vitamin C, B vitamins. If you're kind of short on them, that can make a big difference. It can make you feel a lot better. Uh, but usually you only need one dose of that like every couple months. Like B vitamins in particular, your liver stores them very well. So as long as you don't have any sort of, gastric bypass surgery, you haven't had any like stomach surgery, and your liver functions fine, you've got at least about a year worth of B12 on board. So maybe if you get a pop of IV B12, that'll top you off, and then you're good to go. You just don't need any more. Vitamin D, same thing. If you get a dose of vitamin D IV, you got plenty to go for a long time. And in fact, you can start giving yourself kidney stones if you have too much vitamin D because you absorb too much calcium. While you do have to be careful of places that are selling you things like a half liter of fluid for $80, which somewhere here in town does in fact offer, that's going to do fucking nothing for you. Drink a glass of water. Don't pay them $80 and get stuck with a needle. There's definitely some, bullshit snake oil stuff going on, but IVs can definitely make you feel much, much better. If you're using this for a proper treatment, though, maybe you need to go see your doctor. This is just a recreational thing that's supposed to be once every, blue moon. So if you're a frequent flyer, maybe stop drinking as much or go talk to your doc. Last but not least is everything else. Now, these spas offer all sorts of random stuff, from oxygen therapy to, weird new agey crystal nonsense, or like vaginal rejuvenation even. There's different procedures that have a little bit more merit to them, like cool sculpting or different injectables and things like that. Most of those things have very little evidence to support them being useful at most, and a lot of them have zero evidence. Like, we'll take the oxygen bar concept, for example. Every one of you, unless you have compromised lungs, is setting, like, has between 97 and 99% oxygen saturation at all times. Breathing some extra oxygen is not gonna do anything. And if you need oxygen therapy all the time, that's something to talk to a doctor about, not go pay a medical spa for. That's a big deal. That's a really big deal if you actually need oxygen to increase your oxygen saturation. So the last thing that I wanted to talk about was some criticisms of these businesses in general. So sometimes they kind of offer some slightly shady things, like I mentioned, like most places offer services that have fairly weak scientific support behind them. But some places do things that are a little bit more nefarious. Like, for instance, some places will convince you that you don't need an entire syringe full of filler, which sometimes is true. And then they will use that leftover filler on another person. So that filler technically is contaminated with, whomever's blood, previously got injected with it, and they're using it on you. That is not cool. You should definitely ask them if they use leftover syringes, because don't do that. The realistic risk of you getting some sort of bloodborne disease is extremely low, but that's just terrible practice. Don't ever do that. Do not let anybody inject you with a used syringe. That seems like an obvious thing to say, but lots of these med spas do that. The next thing I wanted to address is IV businesses got a very negative light cast on them on a national scale because of somebody who died in very close proximity to having an IV infusion at a med spa here in Kansas City, in fact. Now, this patient, as I recall, had heart and liver failure to begin with, and got an infusion. He was a regular at this med spa in particular, which I believe is now shut down, possibly as a result of this case. But anyway, he had an infusion, and several days later had some sort of reaction or, illness that caused him to be hospitalized, and he subsequently died. And there were lots of sort of vague connections drawn with this IV service. And I'm here to tell you that if you die from an IV service, you were just about to die anyway. These are very, very benign treatments to have. I mean, most places give you 1 liter of fluid, which is really not very much. You probably got about 40 liters of fluid in your body, so it's a really, small percentage of what your body has in it anyway. So if that tipped you over the edge, something was about to give anyway. The only thing that I could even consider that being from was like if the fluid was contaminated or something like that and the patient got septic and died, but I have literally never seen that happen. I have seen tens of thousands of liters of fluid administered to people, and I have never, ever heard of a bag being contaminated. And it's possible, it's a remote possibility, but that is really, really unlikely. So basically, these places are safe. I personally go by the American Society of Anesthesiologists, basically like patient grading scale, which tells you how sick somebody is. So an ASA1 is basically somebody with no health problems at all. ASA2 is somebody with very well controlled health problems. ASA3 is somebody with like chronic health problems that affect their quality of life. ASA4, and so on. Basically, I refuse to treat anybody who is sicker than an ASA2 in my estimation. So this was purely for healthy people. Like, despite the fact that I know that the risk was extremely low, even for unhealthy people, I just did not want to even bother with it. So if you are truly sick, I would advise against using these services because, like I said, a lot of the time the people administering them are not very well versed in fluid management. If you really feel like you need to be hydrated, talk to your doctor for a better path. So there you go, folks. That's my quick take on med spas and all of the sort of mystery and intrigue surrounding them. So if you have any questions, please don't hesitate to leave a comment or DM me. I am always around. Or you can come see me live on Twitch and YouTube at 8 to 10 p.m. Central on Wednesdays and Sundays. Once again, I'm Milkman Al. Thank you guys very much for watching. Have a great week.